Hello, everyone. The second Thursday of March is world over celebrated as the World Kidney Day. And kidney assumes one of the pivotal organs of human body for a healthy human functioning, one of the very important organ. And according to some recent reports that I was reading, 1 in every 10 people has some sort of kidney-related health issues across the globe. Quite that we are talking about 10% of population. So to talk about kidney health and what all needs to be done to improve kidney health and what all are the complications of it, so that we can actually prevent it by having a healthy lifestyle, we have with us Dr. Sooraj. Dr. Sooraj is the consultant nephrology, toxicology, and renal transplantation at Renai Medicity, a multi-speciality hospital in Kochi. He has numerous publications to his credit and has been part of many path-breaking publications in interventional nephrology in India. Instrumental in pioneering minimal invasive renal biopsies and radiology assisted vascular access interventions in Kerala, he has also been associated with more than 500 renal transplantations. Dr. Sooraj has been instrumental in increasing the awareness regarding kidney diseases among the public and has conducted several awareness camps for them. And this is precisely the reason that he has graciously agreed to talk to all the audience of NuvoVivo and talk to us about the importance of kidney with related to the World Kidney Day. Dr. Sooraj, thanks a ton for agreeing to do this. Welcome to this interview.
Yeah, thank you.
Right. So, Doctor, so first question to go by is that could you explain in simple terms what is the role of kidney in our health and what is its main function? What does it do?
Yeah, Rajiv. So coming to that, most of us are born with two kidneys.
Mm-hmm.
So kidneys are basically they are about the size of your fist. So it will be almost like this.
Mm-hmm.
So or slightly more, maybe 9 to 11 centimeters for a male and 8 to 10 centimeters for a female. So these are bean-shaped organs located on either side of the vertebral column.
Mm-hmm.
So that is your backbone. In the upper abdomen towards the back.
Mm-hmm.
So though they are quite small, they have got very important functions. So we all know that the waste and the excess water what we drink is pushed out of the body through the urine. So that is the primary thing what kidneys do. But in addition to that, the kidneys take care of your bone health. So that is vitamin D3 production happens in the kidney.
Right.
Then your calcium phosphorus homeostasis is taken care of by a very significant manner by the kidney. Then if your RBCs have to mature, that is if the blood has to be manufactured properly, there is a hormone called erythropoietin. So that is taken care of by the kidney. Then there is something called as the acid-base balance. The body has to function at a normal pH, that is 7.36 to 7.42. So that acid-base balance is maintained by the kidney and the lungs. So in short, though very small, kidneys take care of a very important, they play a very important role in the body's homeostasis.
Right. And this is precisely the reason that it is important to take care of the kidney health. So much so that we even have a World Kidney Day, right? So how does a person, for a common man, how does he suspect that he is not taking care of his kidney or there is something serious that he should address with regards to the health of the kidney? How does a person even know? What are the early symptoms of a kidney disease? But I'm not talking about the kidney stones. I'm talking about other aspects of more complicated, bigger complications.
Okay. See, the important part about kidneys is that they are very, their reserve is huge. So unless there is a 70 to 80% of damage, you don't realize that you have a kidney disease. So in order to detect kidney disease early, if you have if you are a high risk person, that is if you are a diabetic or a hypertensive, or if you have a family history of kidney disease, or if you have stones again and again, or if you're having urinary tract infections, or if you have uric acid problems, then you need to screen periodically to see whether your kidneys have any problems or not. And a lot of times you are asymptomatic, that is you do not have any symptoms when you develop a kidney problem. The symptoms what we commonly see are when you have swelling of your legs, that is both your legs, you have swelling, edema, so that is towards the evening, then it might be a sign of a kidney problem. Then another thing is what you call as a periorbital edema. That is in the morning time around your eyes. If you have very puffy eyes, not the usual puffy eyes, but something more than the ordinary. So that is another maybe an indicator of you are having a renal problem. The other signs are you are passing too much of urine or too less of urine. So both may indicate a kidney problem. Then if you're passing urine too many times in night, so some people might go 1 or 2 times at night normally, but if there is anything out of the normal, that is another indicator. Then if your urine color changes, that is if you're having reddish urine or brownish urine, or you're having cloudy urine, then you might be having a kidney problem. Then if you are having a hesitancy, that is you take too much time to go, or if you feel like going, then you need to go immediately. Though it is prostatic symptoms, it might
Mm.
involve the kidney also. And other features are you might be feeling tired, then you might be feeling very lethargic, you might be dropping weight, you might be developing pallor, that is your since your hemoglobin is coming down, you might be
Mm.
feeling out of breath. Then all these are signs of symptoms of kidney disease.
Right. So why do people who are having kidney disorders, why do they end up having blood pressure related issues, and how are they related? How is kidney related to hypertension?
Yeah, first of all, the sodium balance is maintained to a very large extent by the kidneys. So when you have a kidney disease, you tend to retain fluid and sodium. So
Mm.
this might push up your intravascular volume, and it will lead to hypertension. Then there is something known as a RAS system, that is renin-angiotensin aldosterone system. So this also takes a hit whenever there is a renal failure. Then there is known as the renovascular hypertension. So whenever there is a blood supply issue to the kidney, or the blood supply comes down, maybe because the main there is a what do you call a stenosis? That is there is a
A
narrowing
block.
in the a block towards the renal blood supply. This also kicks on the renin-angiotensin system, and ultimately this also drives the BP up. So it is multifactorial.
Right, right. So, what about diabetes? I mean, one of the common things that
Mm.
we get, sadly, is
Mhm.
when diabetes is a disease wherein people kind of, I mean, there is no, not necessarily create, it does not create a pain or a fever or anything. So
Mhm.
people live with it, and
Mhm.
then one fine day they wake up and see, oh, there is an edema in my leg, and they go in and
Mhm.
check their creatinine levels are high, urine microalbumin. They get
Mhm.
to know that it has progressed to diabetic nephropathy, and the sad part is that in Kerala, India is known as the diabetes capital of the world. 60 million plus people, according to the World Health Organization statistics. And of that, the diabetic prevalence is more than double the national average in the most literate state like Kerala.
Mhm.
So, what are the things which needs to be done, and how is it related? Why does diabetes, uncontrolled blood sugar levels,
Mhm.
how does it and why does it impact kidney, and why is it important to take care of, what is the relation between these two?
Okay. So diabetes. So we'll go step by step.
Hmm.
So diabetes, as you have told, we are right. So India is the diabetic capital of the world, and Kerala is the diabetic capital of India. So we are sitting on a big time bomb actually. So we are only seeing the
A
tip of
real
the iceberg
pandemic.
now. Yeah, it's a real pandemic. So if you look towards the maybe what is the high range areas and all, you see more of younger people coming up with diabetes now. People in their 18,
Hmm.
20s, or early or 18, 19, even 20 years. A lot of people develop diabetes nowadays. Maybe because of their lifestyle, maybe because of their food habits, maybe because of family history. But the diabetes is really going up. And the good thing about diabetes is numerous studies have shown that if you develop diabetes now, if your sugars are well controlled, even after 30, the 40 years, you will not develop any of the major microvascular or macrovascular events. So there are numerous studies like Framingham study, and then the UKPDS study. There are many studies which have followed up diabetics for 40, 50 years, which have shown that your sugars, if well controlled, do not cause any of the problems. The
Problems. Yeah.
root cause of issue is inflammation.
Hmm.
Uncontrolled sugars lead to uncontrolled inflammation. So there is what is known as reactive oxygen species, which is
Hmm.
a byproduct of uncontrolled sugars, which
Hmm.
get deposited in all the major organs, like eyes get affected, your kidneys get affected, your blood vessels get affected, your heart gets affected. So ultimately, this is the inflammation which caused the damage.
Hmm.
So if you develop diabetes now, you have 5 years to take care of yourself before you develop a renal issue. The
Hmm.
classical you develop a diabetes now. After 5 years, you will develop what is known as the microalbuminuria. That is small amounts of protein through the urine.
Mm.
And fortunately, even if you catch them at the stage, microalbuminuria is totally reversible. You can cure diabetic nephropathy at this point of time. But
Mm.
if you ignore this microalbuminuria, then you go on to the irreversible stage. The next
Mm.
point will be you start excreting more proteins. That is your macro albuminuria or overt nephropathy. That is proteinuria, instead of milligrams, it goes up in grams. Then
Grams, yeah.
your creatinine starts. Then your
Shooting up.
creatinine starts slowly rising, and then you end up with end-stage renal failure. Then you will need dialysis or renal transplantation or whatever.
Right.
So if you develop diabetes now, if it is uncontrolled, you will start developing renal failure within 5 to 10 years. But if it is well controlled, then you can live maybe 30, 40 or 50 years without any issues.
Right. So when you say the early stages of urine albumin coming in can actually be reversed, when you say that, what do you mean by
Yeah.
is that going under remission, or is it that completely reverse kidney back to normal health?
No. There are studies which show that your microalbuminuria is totally reversible. So
Right.
you can maybe with proper glycemic control and with proper medication, you can bring it back to normal. There are
Right.
two cornerstones. One is you control your diabetes well. That is bring your HbA1c to less than 7. Though in
Right.
elderly, you advise maybe a slightly looser control, maybe 7.5 or so. But the rule of the thumb is you bring down your HbA1c to less than 7. Then only your inflammation will come down. And
Right.
the other thing is there is something known as AC inhibitors or an ARB.
Right.
So these are drugs which can reverse your proteinuria and reduce your microvascular inflammation in addition. So nowadays there are newer molecules like SGLT2 inhibitors. So
Right.
these are fantastic molecules. So what they have done is during the trials they have stopped the trials in between, so that they wanted people to get all the benefits and brought in the molecules earlier to the market. So you have fantastic drugs which can reverse diabetic nephropathy in the early stages.
Early stages, right? So, doctor, what about there are certain supplements in the market like N-acetyl-cysteine and everything? Is that something which is? I've seen many supplements, at least in the recent times, coming up. Does it help?
N-acetyl-cysteine, theoretically, it will remove all the free oxidant, reactive oxygen species, and all the free oxidants. We use it for a multitude of reasons. We use it for to prevent contrast-associated nephropathy. We use it for means acute liver injury. We use it for paracetamol overdose. It is a good drug, but then if your sugars are well controlled, again the role of N-acetyl-cysteine is doubtful. If your
Yes.
sugars are not controlled, it will help.
True.
And those who take N-acetyl-cysteine, they have there's a subjective improvement, even though they say that the frothy urine comes down after taking N-acetyl-cysteine.
Right.
So in a well-controlled diabetic, maybe it might not help much, but uncontrolled, yes, it has a role.
Right. So this reminds me, we keep telling the people who reach out to us that diabetes is like a malapadaka, a cracker, but with a long thread or a long tiri. One gets some time to actually make sure that the thread fire doesn't catch the cracker yet. If you intervene in between, you can actually very well take care of the health and things be in control. So that's precisely what you were putting into in a nutshell with the medical knowledge, right?
Yeah, and let me add to it. And there is a gundu at the end of the Malapadakam, and everything explodes at the end. So, unless well controlled.
Right. Right. What about protein? Protein is, a lot of people think that protein, if you eat protein, very bad for kidneys. What is the real thing behind protein? Is protein bad for kidneys?
We'll analyze it for a diabetic with a normal kidney function without any proteinuria. Yes, you can have a protein in the normal range, or you can have excess proteins if you are planning on a bodybuilding or so. With the you need to consult a proper physician, because you can't take proteins extravagantly, so that might actually be harmful. So with proper means guidance of experts, you can take proteins even in addition, even if you're planning for a bodybuilding or so. But if you're having a kidney issue and if you're having too much of proteinuria, then proteins may in fact be harmful. And non-veg proteins are actually bad for you, because red meat and all, they cause excess proteinuria and excess uric acid, and it might actually damage the kidneys.
Right. It
And in
also.
advanced, yeah, and in advanced renal failure, we actually, there is something known as a very low protein diet along with keto analogs. So
Mm,
which have shown to be actually beneficial. But then when you use the full course of keto analog,
mm,
the cost actually goes up by very much. So
mm.
nowadays, except for a few patients, we don't usually follow that. But the rule of the thumb is if you have massive proteinuria and a CKD, the protein requirement for you is zero. 0.6 to zero. 0.8 grams per
Right.
kilogram.
Right.
And but once you go into renal failure or once you go into dialysis, then actually you need more proteins because you need that much proteins to maintain your body. Then you can start eating better. You can start eating red meat in
True.
a controlled manner. You can start eating white meat more often. Daily you can have proteins.
Right. But also
So
the
that
goal is not to reach till there.
yeah, the goal is not to, yeah, true.
Right.
Yes, yes.
Right. So what about salt and
Mm.
especially sodium? People come to
Mm.
us with, with these issues. Doctor said salt intake.
Mhm.
People sometimes don't even understand the real problem is sodium, and sodium is not just only in salt. Even soy
Mm.
sauce is rich in sodium.
Yes, yes,
Most
yes.
of the packaged food,
Yeah.
the canned
Yes,
food, etc., are rich
yes.
in sodium. So
Cheese,
people,
cheese,
you know,
butter, all those things. Yeah.
yeah. So what is there a particular limit of sodium? Like, for example, for a hypertensive person with a heart issue, we say around 2,500 to 3,000 milligrams of sodium is the maximum permissible range.
Okay.
So with the
Okay.
CKD, is there a limit like that?
Usually we restrict salt to around 5 grams per day. So what we advise is use prepare food without salt
Hmm.
and no added salt like dry fish or pickles or etc. And
Right.
you keep a salt sachet or a teaspoon of salt with you. And
Right.
you can add on the salt how much ever you want to the food. The
Right.
problem with excess salt is it can lead to water retention, it can lead to hypertension, then again it can lead to worsening of the kidneys. So
Right.
it is not advisable.
Right. What about other minerals? Is there anything else to take care of? Calcium, potassium?
Yeah. Then the other question what we usually get is, so can we take the rock salt or indupu?
Hmm.
So indupu is also actually bad for you because it contains potassium chloride instead of sodium chloride.
Hmm.
So, and patients with kidney disease, they tend to retain potassium. So potassium, if the level goes up, it is cardiotoxic. That is, your heart rate can come down.
Yeah.
You can get sudden cardiac arrest. You can develop disorders in the cardiac rhythm. So it is better to avoid indupu and stick on to the usual sodium chloride.
Normal one. Right.
Then other minerals are, we don't advocate heavy metals, so which might be there in certain forms of medications because they can cause renal toxicity.
Hmm.
Then excess calcium, anything excess is bad. So
True.
anything in the desired amount is
Right.
acceptable.
So for somebody having a kidney disorder, are there any particular vegetables, really anything which you would suggest not to go overboard on?
Green leafy vegetables are usually avoided.
Hmm.
Then pulses you need to avoid, but then you need to take certain amount of pulses because otherwise you will go into malnutrition. So
Right.
you can take certain amount of pulses, but that too with the you can always take the help of a qualified dietitian or ask
Yeah.
your doctor, and then you can do what is known as leaching. Then you can put it overnight in water, or then boil it with water and throw away the excess fluid and then use it. Then you need to avoid sprouted vegetables because
Hmm.
sprouted pulses, sorry, because it has more protein and more phosphorus in it and some more potassium in that. And cruciform vegetables are better avoided. That is cabbage, cauliflower, broccoli,
Kale, spinach.
tomatoes. Yeah, tomatoes in excess. You can have 3 to 4 per day, but not more than that.
Right.
And,
Right. Right.
another thing is if you develop CKD, then we don't advise raw salads. Instead of that, you can use boiled vegetables
Hmm.
instead of that, steamed vegetables.
Right, right. What about water intake? I mean, we keep saying
Mm,
that 1 liter per 20 to 25 kilograms of body weight.
mm,
That's the
mm,
reasonable ceteris paribus. All other things being equal, no
mm,
other medical conditions.
mm.
Person having kidney disorders, is there a limit that you go by, or how is that? Or water? Should a person with a kidney disorder should that person drink more water?
See, the usual amount of water a normal person needs is 10 to 15 glasses per day. But if you are working out, or if you are a runner, or if you do too much of aerobics, or if you sweat a lot, then you can take more as per your thirst. Basically,
Mhm.
your thirst is your mechanism to denote how much of water the body needs. If you're feeling excessively thirsty, maybe you are underfilled and you need some more water. For a person with kidney disease, how much of water you should take depends on your urine output. If your urine output is good and if you don't have any swelling of your legs or edema, then you can consume normal water provided your heart is good.
Mm.
Your heart also needs to be good to pump out whatever water you are taking.
Okay.
If you are having edema and your kidney position is bad, then you need to restrict on your fluids. Otherwise, again, it might means accumulate there, leading to edema and fluid overload. So that is the rule of the thumb. We don't advocate excess water, means 5 to 6 liters and all. This
Mm.
can improve. This can cause alterations in your counter current mechanism. So that is,
Mm.
there is something known as a counter current mechanism that absorbs the urea, maintains the tonicity inside the kidney. That can get
Right, right.
hampered when you drink too much of water, and it can also lead to hyponatremia. So usual intake should be 2 to 3 liters. So
Right.
to cut short, if you have a CKD and if your urine output is good, you can have maybe 2 or 2.5 liters. If you are developing edema, you should bring down your fluids. If you're having a cardiac problems, you should restrict your fluid intake.
Right. And that needs to be done based upon a consultation with the doctor and not necessarily by
Yes.
deciding by yourself.
Yeah.
Right.
Yes. Yes. Yes.
Right. So that takes us to yet
And
another.
and one more thing, and there is a custom of when you wake up in the morning itself, drinking 1 or 2 liters of water in the morning. Again, we don't advocate that. Maybe 2 or 3 glasses, maybe that should be all right. But 1 to 2 liters is almost going overboard.
Any healthy habit, if you overdo, is always bad for
Yes,
the
yes,
body.
yeah, yeah,
Right.
true.
Even the amrit, if
Yeah,
you
yeah.
do more, it's bad for the body.
Mm.
So well put. What about kidney stones? People generally have this notion that calcium is the villain, but is it only calcium which is the villain? What needs to be done? What are the things which needs to be taken care of?
Stones are a big topic because stones are not calcium alone. It can be a mix. It can be calcium oxalate stones. It can be oxalate. It can be uric acid
Uric
stones. It
acid.
can be purine stones. It can be other stones like cysteine. So it can be means a lot. A single stone might be because you are not drinking adequate water, or maybe you are having maybe your diet is not proper. So that might be the reason. The commonest reason why people develop stones is you don't drink adequate water,
Water.
and means your food becomes means dicey. Maybe you are eating too much of junk food, too much of salt, everything.
Mm.
And if you are having again stones again and again, that is what we call a recurrent stone former. We need to analyze the stone to see what the content exactly is, and
Mm.
take adequate
Very
precautions, and
precious.
follow the proper diet. So that is what needs to be done. If we cannot get the stone, and if you are still having a if you're still a recurrent stone former, we can do a urine analysis to see what element is going to the urine, is going excessively through the
And
urine,
then
and then
make
take
deductions
remedial
on what
measures.
that stone could be.
Yeah, make deductions. And some people have familial stones, or they may be having some enzyme abnormalities, so
Mm.
which might be leading to excessive oxalosis, etc., which might be
Mm.
leading to renal failure. So we need to see what exactly the content is and then do. And to prevent stones, the rule of the thumb is you need to take plenty of water. You need to piss more often. You need to take a lot of citrus fruits. Avoid cruciform vegetables. Come down on your salt. So these are the usual things what we need to do.
Right, right. So, this almost we are ending. So, one last question that I have is that regarding dialysis. So, people who are having a chronic kidney disease or a failure ends up getting into a dialysis mode. So, once a dialysis starts, is that for a lifetime?
So before that, we need to see what form of kidney failure the patient have.
Hmm.
Basically, there are two types of kidney failure. One is an acute kidney failure, wherein we know that the patient's kidney was normal, and
Hmm.
then he developed a sudden renal failure. So it might be due to a snake bite, it might be due to a drug, it might be due to an infection, it might be due to what is known as a glomerulonephritis.
Hmm.
So in these cases, even if we take them in case dialysis is required, there is a good chance that the kidneys will recover, and the patient and the person will not need dialysis in the future. The
Sure.
second type of renal failure is a chronic renal failure. So this happens with diabetes mellitus,
Hmm.
hypertension, then all the other areas what we discussed. So
Hmm.
these patients, if they develop slow worsening of renal failure, and then they develop what is known as uremia, then if they require dialysis, most of them will need to continue dialysis in the long term. Then there is something in between. That is a person who has diabetes, with the mild renal failure who develops sudden worsening of renal failure, maybe because of a stone or maybe because of an infection. So these patients also, even if they need dialysis, after we treat the basic cause, they will come off dialysis and will not need dialysis for some time. And dialysis, there is a common fear factor among the people. Means dialysis means then you need to
End of the
continue.
story. Yeah.
Yeah, end of the story. But that is not the case, because there are a lot of people who do dialysis and going on strongly. There are bank officers. There are people who do businesses. There are housewives. There are people who have started. We have a youngster with us, so who was sort of a freakin, what do you call a freakin? Then he went on dialysis. Then he started his own business, started doing his own. He's doing quite well. Comes for dialysis, do business in the meantime. We have lift operators who climb 14, 15 stairs, lift mechanics, and go for work on their means off dialysis days. So there are people who do well on dialysis. Lot of bank employees who come and do dialysis at night and go for work in the daytime, who travel to outside Ernakulam, live in Ernakulam, but they go outside like Kaladi and Angamali, etc., and then travel by bus and then come back.
Come back.
So maybe it is your means your state of mind. So if you listen to everybody and
True.
think that dialysis is the end of the road, then you become like that. If you have
True.
optimism and then do that.
Right. 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 Takes us to the last question. In a nutshell, general tips with regards to kidney health could be from a drinking water perspective or taking care of health perspective or lifestyle perspective. If you could give me in a very short, brief tip, this would be the last question.
Okay. So the first thing is you should drink 10 to 15 glasses of water,
Right.
maybe exercise maybe 30 to 45 minutes. If you have diabetes, you keep your HbA1c less than 7. If you are a hypertensive, you keep your blood pressure below 135 by 80. Then if you have recurrent stones, you should analyze what stone it is and take appropriate measures. Then if you have a family history of kidney disease, like a polycystic kidney disease, then by age 30, you should see whether you're having that disease and do undergo periodic screening. If you are a diabetic, initially every year or every couple of years, you should do a proper screen. That is urine. The minimum things what you need is a urine albumin creatinine ratio and a RFT. Initially, every 2 or 3 years should be enough. And as the diabetes progresses, every year or every 6 months should be done. Same if you are a hypertensive, because early nephropathy can only be picked up by routine screening. You might not have symptoms for that. Then you should avoid over-the-counter medications like unnecessary antibiotics, unnecessary painkillers, and unnecessary alternative system. Everything you should avoid. And last of all, you should have a positive outlook. Having a kidney disease is not the end of the road. We all live with kidney disease nowadays because the kidney disease is so rampant. So we might be a caretaker for a kidney disease. We might be caring for a patient with kidney disease. Some of our family members may be having a kidney disease, or you yourself might be having a kidney disease. But we every day we encounter people with kidney disease, and we have to live with them. And it is not a bad life. A lot of them do well in the long term, and we can, with the newer medications, we can prevent progression of kidney disease to renal transplant or dialysis to a very large extent. So I think that should be the message.
Right, right. Thanks a ton, Doctor. Thanks a ton for talking to our audience. The World Kidney Day, the second Thursday of March, happens to be on 11th of March. And this interview series is done with association to that Dr. Sooraj from Renai Medicity, which is a multi-speciality hospital based in Cochin. If you want to reach out to Dr. Sooraj, you could reach out through the hospital website, that is renaimedicity.org, RENAIMEDICITY, renaimedicity.org. You could reach out if you want to take consultation, want to take opinions, etc. Dr. Sooraj is the man out there who can help you with whatever your kidney-related troubles are. Thanks a ton, Doctor, once again for coming and talking to us.
Yeah, thank you.
Thank you. Take care. Bye.
Okay, bye.
Bye.